We have some questions from the live Q&A. Maybe I get Dr. Chan to address. There's this question on, since many children that were infected with COVID do not exhibit symptoms, there is a chance that a child may already be infected or recovered from the virus without them knowing. What are the implications of a child taking the vaccine while being infected or recovered from the virus in the last 180 or 270 days? Dr. Chan, please.
Yes, so the general recommendation is that we do not need to test for past infection, which was perhaps unknown, undiagnosed, asymptomatic, before giving the vaccine. There is some suggestion that actually the best immunity you can have is a combination of natural immunity from having had the infection as well as having vaccine immunity after having had the vaccine. Generally, if we know that somebody has been infected, we say that natural immunity will last you maybe about 3 months before that really starts to wane to a level where it won't protect you. And that's why we recommend that if you know you've had COVID, wait for about 3 months and then you get a single dose of the vaccine. And I think in a similar way, it is not unsafe at all to give a child the vaccine without actually even knowing whether they've had the infection 6 months ago or 9 months ago or 12 months ago.
Thank you, Dr. Chan. Maybe we'll now move on to the second category, where we address more on medical eligibility for vaccine. So we have this group of questions where they talk about the allergies to paracetamol, and then G6PD deficiency, and then kids with history of Kawasaki disease, heart condition, and eczema. And also there's also some children who have recovered from COVID-19, whether they are suitable to take the vaccine or will they need to wait for a certain period of time. So can we have Dr. Chan or Prof. Heng to address some of these questions? Thank you.
Okay, so maybe if I address the last question first, which is what I just mentioned, which is that if you have recovered from COVID-19, wait 3 months and then you can have a single dose. And the single dose after a confirmed COVID-19 infection would be considered as being fully vaccinated. For the other questions, I think there is a very long list of medical conditions that people might be asking about. And the short answer is that for all those conditions listed there, they can all have the COVID-19 vaccine. Now, the people who we would say should not have the COVID-19 vaccine are those who have already had the first dose and then develop something called anaphylaxis after it, which is a very serious allergic reaction, which is very rare, where they get sort of eye swelling, face swelling, difficulty breathing, low blood pressure. People who've had the first dose who get skin or other facial swelling within 4 hours of the vaccine, or people who've had the first dose and have had myopericarditis. So all these people who've had first dose and had any of those 3 serious reactions should not go on to have a second dose. The only other group of people who shouldn't have the vaccine are those who are known to be allergic to a substance called PEG, or polyethylene glycol. And this is actually a very common substance in cosmetics and other commercial products. So if you have a known allergy to PEG, then you should not receive the vaccine because that's a component of the vaccine. I think for some children who have serious medical conditions, so for example, if you have an immune system problem, so something that makes your immune system weak and vulnerable, or if you have serious heart conditions, lung conditions, or neurological conditions, where especially you might be needing home medical support. So some children are on oxygen at home or requiring other kinds of medical support at home. These children should discuss it with their doctor first regarding the timing of their vaccination and where they should have it. But other than that, everyone else should be okay to be vaccinated.
Thanks, Dr. Chan. That's very helpful. Prof. Heng, would you like to add?
Yeah, just to add on the issue about safety for someone who's recovered into taking a vaccine. Just to say that this is in fact a recommendation that people who were unvaccinated but had the infection and recovered, they should take an additional dose of the vaccine to complete their immunity, right, so to speak. And this has been the case in basically thousands of adults, both locally as well as overseas. So many adults who were previously unvaccinated before they caught COVID have been vaccinated very safely with additional vaccine. And the data shows that it is safe and one dose is effective enough because it's basically considered the infection to be the first dose, so to speak. Yeah. Right. And just to also add to the answer about the serious medical conditions, as I said, that I think in general, it is safe for these children to be vaccinated. The only question regards timing, because in certain kids who are under immunosuppressive medicine, you may want to consult the doctor on the optimal timing, because you may want to time it, in between, say, cycles of chemotherapy, for example, so that the body is able to best respond to the vaccine. Yeah, thank you.